That's an excellent question. And I think we always try novel drugs in the relapsed refractory setting initially, but when they show efficacy, then we're certainly going to try them in earlier relapsed refractory multiple myeloma newly diagnosed patients, which is with many ongoing studies looking at this patient population currently. And so I think really moving forward, it's the sequencing of BCMA-targeted therapies is a very, very important question that's going to be paid attention to very closely. And so there is some data so far, for instance, with teclistamab that was presented at the ASCO meeting earlier this year, that show that in patients who did receive prior BCMA antibody drug conjugates or CAR T therapies did still respond favorably to BCMA bispecific T-cell antibodies with overall response rates of over 50%. Conversely, there is some data, at least in the real-world setting, that suggests that patients with prior exposure to BCMA bispecific T-cell antibodies or ADCs don't respond as well to BCMA CAR T therapies. And so there's a lot to still unpack about this. These are initial clinical observations. What may be driving resistance is also a very, very important question, whether there's potential loss of BCMA more so in bispecific T-cell antibodies versus CAR T. There's many, many important questions that needs to be done through translational work that we hopefully will be able to answer hopefully in the next 3 to 5 years, hopefully.